afternoon. It looks like people are still joining us, so we're going to wait 2 more minutes and then we'll get started. So thank you for your patience. Good afternoon. Thank you so much for joining us for our webinar entitled Delivering Your Message in Person, the Nuts and Bolts of Meeting with a Key Decision Maker. My name is Robin Grant, and I'm the Director of Public Policy and Advocacy at the National Consumer Voice for Quality Long-Term Care, or Consumer Voice for short. Next slide. For those of you who may not be familiar with us, we're a nonprofit organization that advocates for quality care for consumers receiving long-term services and supports in any setting. So that includes at home and within the community, in assisted living, and within a nursing home. So today's webinar is the second of a 4-part advocacy skills training series that we're offering over the next several months. And we'll share information about the following 2 advocacy training webinars at the end of today's presentation. But the goal of this series is to give you strong or stronger advocacy skills so that you can advocate not only for what we will be talking about today, which is registered nurse or RN coverage in nursing homes, but so you can advocate really for any cause or goal that you as an individual or maybe even as a coalition may have. So the skills that you'll be getting should be applicable to any advocacy that you wish to do either as an individual or as a group. So the Consumer Voice is currently working on a campaign to get 24-hour registered nurse coverage in nursing homes. So in our advocacy skills training webinars, we're using this issue as our training example. So that way, our hope is that you can take the advocacy skills that you learn on these webinars and apply them immediately. Next slide. So here's what we're going to be doing in our time together today. We'll begin the webinar by giving you information about the issue of round-the-clock RN coverage in nursing homes and a bill in Congress that would require all nursing homes that get money from Medicaid and or Medicare to have an RN on-site 24 hours a day. Next, for those of you who could not join us for our first webinar, we'll talk briefly about 2 areas that we previously covered that we feel that you need to know about for this webinar. The first is how to develop a strategy around an advocacy issue using a tool called the strategy chart. And the second topic we're going to cover is what we call the Big 6. These are 6 points that you need to include in developing an effective advocacy message. After that, we'll get into the meat of this webinar, which is how to arrange, prepare for, conduct, and then follow up after a meeting with a decision maker. So joining me today as a presenter is Mary Beth Williams, our Public Policy Associate, who is my partner in our policy work. Before we get started, I have just two housekeeping points that I wanted to make. First, all of your lines are muted now and will remain muted throughout the webinar so that everyone can hear the presentation without background noise. We will be answering questions at the end, but as we go through our presentation, if a question pops into your mind before then, you can ask it at any time by typing it into the box that says questions/chat on the right-hand side of your screen. So feel free at any point to ask a question. And second, in terms of the materials for the webinar, we will be emailing you tomorrow with a link to the handouts and to a recording of the webinar that is combined with the PowerPoint slides. So please be looking for that. Okay, I think with that we're good to go. So next slide. All right, I'm now going to turn things over to Mary Beth to talk with you about the RN issue.
Great, thank you, Robin. So before we go any further in today's webinar, we wanted to provide you with a brief overview of the issue we'll be using throughout today's presentation, which is one of our main policy priorities as an organization this year, and that issue is advocating for the passage of H.R. 952, the Put a Registered Nurse in the Nursing Home Act. Next slide. So this bill was introduced by Congresswoman Jan Schakowsky of Illinois in February of this year and is pending in the House Ways and Means and Energy and Commerce committees, where it must pass to move any further in Congress. Why is this bill important? Well, it would require nursing homes that receive Medicare and or Medicaid reimbursement to have a direct care registered nurse on duty 24 hours a day, 7 days a week. We firmly believe that RN must be on duty 24 hours a day because he or she is the sole nursing professional in a nursing home who can conduct nursing assessments. Per current federal regulation, nursing facilities are required to have an RN on site in the building for only 8 consecutive hours each day. Under current rules as well, that RN does not have to be a direct care nurse, so he or she could work in administrative capacity. Now, why is 24-hour RN coverage so critical in our nation's nursing homes? Well, over the past decades, the medical intensity and complexity of care for residents has increased dramatically. A resident who is elderly, frail, and has multiple complex conditions may be discharged from the hospital to the nursing home 1 to 2 days after surgery for a fractured hip. This requires expert nursing skills to anticipate, identify, and respond to changes in condition, ensuring that appropriate rehabilitation and maximizing the chances for a safe and timely discharge home. The high level of skill and knowledge for oversight and care is needed 24 hours a day, 7 days a week. RN coverage for only 8 hours a day leaves residents vulnerable, undermining effective prevention of complications and possibly delaying important interventions. In addition, the absence of RN staffing for up to 16 hours each day means that there is no one present capable of assessing and responding when residents' medical conditions suddenly change or deteriorate. Now, how do registered nurses help to improve nursing home care? RNs are the only nursing personnel with education and licensure to conduct head-to-toe physical assessments, interviews, and record reviews in order to draw conclusions about nursing diagnoses, appropriate nursing interventions, and care planning, to continuously monitor and evaluate interventions, and finally to lead the healthcare team in providing care for each resident. RNs are also the nursing home staff members who work directly with residents and other medical professionals, develop plans of care that promote the resident's highest level of health and well-being. Higher RN levels result in lower antipsychotic use, fewer pressure ulcers, less restraint use and cognitive decline, fewer urinary tract infections and catheterizations, less weight loss, and less decrease in function. Of particular relevance to today's healthcare improvement initiatives is the decrease in unnecessary hospitalizations of nursing home residents. And research has shown that savings in hospitalizations pay for the increased RN time. As you can see, passage of H.R. 952, the Put a Registered Nurse in the Nursing Home Act, that would give nursing home residents access to a RN 24 hours a day is critical for quality care. This is why we as an organization are strongly supportive of this bill, and we'll be using it as an example in today's training. Now I'm going to turn it over to Robin to provide you an overview of the strategy chart tool. Robin?
Thanks so much, Mary Beth, for that really good description about the need for an RN around the clock and its importance. Next slide. What I'm going to do now is explain what's called the strategy chart, what it is, its components, and how and why you should use it. The strategy chart is an advocacy tool that is designed to help you win an advocacy campaign. So winning is all about power. The people who have the power to give you what you want are the decision makers, and you want to gain enough power to make them do something that they may or may not otherwise really have wanted to do. So decision makers can be legislators, nursing home administrators, state officials, or others who you're trying to get to do something in the public interest. So that's the meaning of decision maker that we'll be using here. However, I did say that you can use these skills in your own personal life too. So a decision maker could be a boss who you're trying to get to give you a raise, or a spouse who you're trying to convince to vacation on that exotic island where you could spend your days sipping drinks with tiny little umbrellas. So the strategy chart itself was developed by the Midwest Academy, which is a very well-respected advocacy training organization in Chicago. And this academy has worked with hundreds of groups around the country to map out successful campaigns. And they always start with a strategy chart. So the chart is designed as a way to organize the campaign or develop a plan. That's really what the strategy chart is. It's a plan for how you can use your resources to build your power to the point where you can change the mind of a decision maker. So as I noted, you can use it as an individual, you can use it yourself, but its particular strength is that it helps a group of people develop a plan together that will move their issue forward in a logical way. So it's a plan with a goal, and it's a way literally to get everyone on the same page. So the chart has a number of different components that help you break down your goal into achievable chunks. It helps you analyze and identify the resources you have to assist you in accomplishing those chunks and what steps you're going to take. So the chart is very concrete. It talks about the actions that you're going to take. It documents who is going to do what by when, so you can track your work, and it helps you hold each other accountable. So I think you can view the strategy chart kind of as a roadmap or as a sort of GPS, I guess. You think through the best way to get from point A to B. But sometimes, you know, you run into construction, you run into bad weather, run out of gas. So in GPS terms, you need to recalculate, change directions based on how things are going and what's working or not working. So the strategy chart is a living, breathing document that can change and should change as you move forward in your campaign. With that as a background, let's look at a breakdown of what is actually in the strategy chart. Next slide, please. And I do want you all to know that in the materials that we will be giving you the link for, you will have this a hard copy of the slide that you see in front of you, as well as a blank copy, as well as a sample of how we completed the strategy chart for our 24-hour RN campaign. But you can see that there are 5 key areas included in the strategy chart. And each of these areas needs to be thought out and developed prior to beginning an advocacy campaign or working toward a certain goal. So you can see that these areas include goals, organizational considerations, constituents and allies, decision makers and opponents, and lastly, tactics. And tactics are what you're going to do to achieve your goals. So obviously the most important place to start is determining what goals you have in an advocacy campaign. What exactly is it that you want to achieve? So goals are always victories that you want, and there are 3 different types of goals that you should consider when completing your strategy chart. So the first is your vision. This is big picture. This is your big picture goal. What do you want to see happening in the long term? So this is not something that you see as being achievable in the immediate future, but what you're working toward. Next is your demand. So the demand is an immediate objective, something that you think you can achieve within maybe the next year to 18 months. It moves you toward your long-term vision. It's realistic, achievable, specific, and measurable. And the demand is something that you win from someone with the power that you have. But we don't always have, unfortunately, enough power to achieve our demand, despite our best advocacy efforts sometimes. So what do you do if you misjudge how much power you have? So that's where a fallback position comes in. So fallback is basically your plan B. You want to think about what you'd be willing to accept, not happily probably, but what you'd be willing to accept if you can't get everything you want. It's that C word, compromise. What you can get that would still move you toward your vision, but certainly wouldn't be as good as your original demand, but it would be progress. So next on the chart, after issue goals, you need to consider your organizational considerations. So this is where you analyze what resources you have. Now, it could be your resources as an individual, but for the purposes of our presentation today, we're really thinking about your resources as a coalition, as an organization, or as a group. So what resources you have that can help you achieve your demand. You want to identify what strengths and resources you have now and what you would like to have by the end of the campaign. So the idea here is to get a twofer. While you're conducting your campaign and working towards your goal, you want to also build and grow your organization or your coalition, or grow your own resources, so you come out stronger. So you start by looking at what you have right now. So you think about resources like, well, how much money do you have? How many supporters? What communication tools do you have? Because those are all resources and strengths. After that, you want to think ahead and determine where you would like to be at the end of your campaign. So on the chart, this is the then that you see. How do you want your organization or your group to be strengthened? And here you want to be very specific. So for instance, as an organization, you might want to raise $2,000, or you want by the end of your campaign to have created a system to activate people in your network. Or maybe you want to have increased your membership by 20%. So again, you're looking at how you can come out of this stronger. The next column is constituents and allies. So constituents and allies are those folks you can rely upon to support your campaign. They're the people who care about the issue and who are going to help you. So in general, constituents are the people who make up your network, your circle. So if you are a membership or were a membership organization, Constituents would be the individuals who would be your paid members. These are people who are committed to your organization or to you if you're working at this as an individual. So you want to step back and you want to identify those who already are constituents. And again, you want to think a little bit down the road toward the outcome, and you want to think about who you would like to have become your constituents by the end of the campaign. Because again, this is about growing your organization or your group. So allies are people who may not be interested in joining your organization, probably aren't, but they'll support you on this particular issue. So they care enough about this issue to help you achieve your demand, but they may or may not support you on other issues. They're with you on this one, but not necessarily on the other issues you work on. So you want to think about who those groups are, and just as you did with constituents, you want to think about who else you would like to obtain as an ally. So again, at the end of the campaign, you're strengthening your organization or coalition. So one other point about allies, it's really great if you can get sort of what we call unusual suspects on board with you, or I guess another term for this is strange bedfellows. I mean, when you team up with a group that is not normally associated with your work, it can really get people's attention and really send a strong message. So after thinking about constituents and allies, you want to consider decision makers. And these are the people who can make your demand a reality. And then the opponents you also need to think about, and those are the folks that are going to be working to make sure you don't achieve your demand. So you are trying to influence decision makers, and there are two types of decision makers, as you can see on the slide. Primary decision makers are those who have the power to say yes or no to your demand. You know, the buck stops here. You want to make sure that the primary decision maker is a real person, though, or person, so it's not an institution. So, for example, you wouldn't say that your primary decision maker is the legislature. What you'd want to do is identify if the primary decision maker or makers is, you know, senators or representatives you want to influence, and even, if you can, to drill down more specifically and identify, for example, individual senators or representatives that you will be looking to who have the power to say yes or no. So this could, for example, be the chairperson of a particular legislative committee. Those are primary decision makers. They can say yes or no. The secondary decision makers are people who don't have the power to give you what you want. They can't say yes or no, but they have more influence and power over the primary decision maker than you do. But secondary decision makers can really help you put pressure on and influence the primary decision maker. So for example, in the legislature, a secondary decision maker could be a staff person who works for a legislator. In a nursing home, if the administrator were the primary decision maker, a secondary decision maker might be the director of nursing. So again, these are folks that can help you in influencing the primary decision maker. So finally, you need to identify your opponents. These are organizations that are going to be using their time, talent, and treasure to make sure that you don't win, you don't get your demand. So clearly, the more opponents you have, the more, the harder you're going to have to work to win. Finally, in the last column are tactics. Tactics are the very specific, direct steps or actions that you're going to take to put pressure on the decision makers to make them give you what you want. So tactics really should be fun. They should be things that your members or constituents or allies feel comfortable doing. It's great if they're creative, that they're media worthy, It's fabulous if they're unexpected. It's really good that they be legal, but they should also strengthen your organization. So they can include things as such as petitions, postcards where you get people to sign and send the postcards in, social media campaigns, in-person meetings, marches, sit-ins, town hall meetings. There's a wide range of tactics. Frankly, anything that you can think of that will help achieve your demand, a concrete step. And it's always really good if the tactic is something that is attention-getting but clever. So your tactics should reflect your best thinking at the moment, but should definitely change over time based on how the campaign is going. So sometimes something will happen that is a perfect hook for an issue and you want to capitalize on. So for instance, if a major story broke that related to your issue, you might do a press release with a statement, a letter to the editor. You might work with advocates across the country to submit letters to their local papers. You are changing your tactics at that moment in order to take advantage of that breaking story so that you can use that to help you win on your issue. So next, we want to briefly talk about how you develop your advocacy message. This is the strategy chart helps you think through your campaign, and in your campaign you will have a specific advocacy message. That is the point that you want to get across. So Mary Beth is going to talk with you about a simple way to create that advocacy message that we call the Big Six. So next slide.
Awesome. Okay. Thank you, Robin. So I'm going to do a brief review of the Big Six. Hi, can you hear me? Okay, so I'm going to do a brief review of the Big Six. Now, if you've attended our first advocacy webinar, you'll remember these points. These are the key 6 items that should be part of any advocacy message. Next slide. So number 1, the first part of this is having an opening statement that includes your ask. So right away, you're going to want to get your audience attention with a fact or a statement. This should only be a sentence or 2 and should really be your lead-in and opening. You want the statement to engage the person that you're talking to. In addition, make sure to include a positive statement about the decision maker, the issue that you're there to talk about, and the ask. The ask is where you tell the person, that decision maker, what action you'd like them to take. In our example today, it's going to be co-sponsoring the Put a Registered Nurse in the Nursing Home Act. So that's the key ask. And again, that should always be included in your opening statement no matter what it is. The next part of the Big Six is presenting the problem. So you're going to want to present the problem that you reference in your opening, that issue that you referred to. Lay it out for your audience. Discuss why it's important, who it affects, and what it does to them. You're then going to want to give the facts. Once you describe the problem, it's really important to give the facts about it, including any figures or data that you can. Facts, figures, and data are really important because they help reinforce your position. The next of the Big Six, number 4, is to give a personal example or story. This helps put a human face on the issue that you're talking about, leaving your decision maker with more than just cold facts and data to support your ask. So data and cold facts are great and they're essential, but if you're also able to give a personal example, it doesn't necessarily have to be your own. It could be an example pulled, for example, from a survey report or one that another individual has shared with you, just to kind of help illustrate the issue and what's going on. And you'll see that later when we do a role play about today's topic. Okay, after you give a personal example, you're going to want to connect to something your audience cares about, their values, wants, and needs. For example, why should they care about the issue you're talking about? What's in it for them? So people are motivated to do things in order to get something out of it for themselves, their families, or their community. So what you're doing is appealing to a person's self-interest. Now, this isn't always a bad thing. It's really what motivates a person to take action. So to connect the issue back to your audience, you'll need to know something about their values, what motivates them and what matters to them, their self-interest. This is where it's really important to do some research about the person that you're meeting with before you do the meeting. Lastly, the last part of the Big Six, number 6, you're going to want to reiterate that ask that I talked about. This is, again, the action that you want your decision maker to take and what you included in your opening statement. It's important to reiterate this at the end of the message to remind who you're meeting with the next steps that you want them to take following the meeting. And there's a handout on the Big Six included in our webinar resources webpage that we provided to you that's going to help you remember these key items moving forward. So now that I've given you a quick review of how you're going to want to craft your advocacy message, Robin is going to begin the main portion of today's webinar. Next slide.
Okay, thank you, Mary Beth. So once you have your message, you have to deliver it. And delivering it is just as important as developing it, because if you can't get it across well and effectively, you're not being heard, and your message is not going to be successful. So next slide. There are 3 parts to delivering your advocacy message. The first is arranging and preparing for the meeting. After that, you want to conduct the actual meeting. And then finally, following up after the meeting, because following up is just as important as the other components, and sometimes it's something that tends to get forgotten. So Mary Beth is going to talk with you about how you would arrange and prepare for the meeting. Next slide. Mary Beth?
Yes. Okay, great. Thank you. So we'll start by discussing how you're going to want to arrange and prepare for your meeting. Next slide. So the first part of arranging a meeting, you're first going to want to figure out who the appropriate person is that you should meet with. Next slide. One of the easiest ways to find out who your elected official is by going to votesmart.org. So on this site, you'll simply enter in your mailing address. All of your state and federal elected officials will come up as a result. Now, if you're having problems with this site or how to find your congressperson, let us know after today's webinar by getting in touch with us via email that we will have provided to you, and we'll be happy to help. Next slide, please. Now, ideally, when you're speaking to an elected official, if that's the key decision maker that you're talking to, ideally you'd want to try to meet with them directly. But the case is, generally these people have very busy schedules and they may not be available, which is perfectly fine. If they are unavailable, then you're going to want to ask to speak with a staff person who works on aging or health issues in their office. At the state level, you may meet with the legislator more likely, or their assistants if they're not available. But in Congress, you'll be most likely meeting with a staff person in the office. So if you're doing this at a nursing home, the administrator would probably be your best bet. That would be the decision maker in that situation. Now keep in mind the secondary decision maker that you learned about from the strategy chart. So this is the person that has influence over the primary decision maker. If you can't get to that primary decision maker, you're going to want to consider the secondary decision maker and use them as a part of your message delivery team. So again, it's perfectly fine if you can't meet with that key decision maker, if you can't meet with that legislator, if you maybe can't meet with the administrator. Use the opportunity to meet with that secondary decision maker and inform them about the issue and have them be part of carrying your message, that advocacy message, to the primary decision maker. Next slide. So regardless of who you're meeting with, it's always best if you set up a time to meet beforehand. Scheduling a meeting in advance gives you a better chance of getting that person's undivided attention as opposed to just catching them on the fly and trying to speak with them. It's also respectful of their time and gives the meeting more weight than if you were to have it at the spur of the moment. In addition, it gives them time to research you and the issue you've told them you're coming to talk about if they're inclined to do so. That being said, sometimes legislators and other primary and secondary decision makers may only have time to speak to you when they're walking from one meeting to the next. So try to be flexible in terms of where and when the meeting is going to take place. Next slide. So with Congress, to set up your meeting, you're going to want to contact the appropriate legislative staff member directly to set up that meeting, or contact the congressional office's scheduler. So if you would like to meet with a staff member in a congressional office, either at the state or federal level, contacting that staff member directly is the easiest way to set up a meeting. If you would like to meet with the congressional member themselves, you'll need to go through the office scheduler in their district office, or either in their office in D.C., depending on where you're meeting. And again, if it's a state official, it would be the state official scheduler. Now, to find the contact information for a staff member office scheduler, you can call the congressional office and ask them for the name and contact information of the appropriate staffer for the issue that you wish to discuss in your meeting, or the name and contact information for the office scheduler. If you're setting up a meeting with a legislator, make sure that you say you're a constituent. So this goes to both the state and federal level. Really gives you weight. It means that you live in the area that the legislator serves and are able to vote for or against them. So if you're setting up a meeting with a nursing home administrator, if you're looking at that to be your primary decision maker in your advocacy, the easiest way to do that would be to call them directly. Now, here are some pointers when scheduling a meeting with an elected official. You're going to want to email the legislative staff member, depending on the type of meeting you're requesting, a meeting request, including a list of issues you'll be talking about and fellow attendees that may be in attendance, and be certain to mention you are a constituent of the member in the request. Next slide, please. Okay, if you don't hear back in a couple of days, follow up with another email and then a phone call after sending that first written request. Next, you're going to want to make sure to schedule carefully to ensure you'll be on time, but not too early for every meeting. So be prepared, again, like I said, to meet anywhere, standing in the hallway or on the run to a vote. Oftentimes, legislators and their staff are very busy, and it's always best to be adaptable if you can, and that goes for anyone that you're meeting with. So you always want to make a good first impression, and being adaptable is certainly one way to do that. Okay, now I'm going to turn it over back to Robin, who's going to talk a little bit more about preparing for the meeting.
Thanks, Mary Beth. Next slide. So after the meeting has been scheduled, you want to prepare for the meeting, and the first thing to do is to decide who is going to join you. So if at all possible, it's always great if you can deliver your message with others. It shows that there are other people that feel the same way about your issue, and it strengthens your message. You want to make sure, though, that you don't bring too many people to the meeting, because having too many people can be a distraction and can bog things down. So our experience has been that a total of 3 to 4 people, and preferably 3, is an ideal number if possible. So who should those 3 people be? First of all, if you're making a legislative visit, all 3 people need to be constituents, if at all possible. Constituents are key because, as Mary Beth said, they're the ones that have the power to vote legislators in and out of office. So a really great threesome for a legislative visit would be an ombudsman, a member of an advocacy organization in your state that works on your issue, and a consumer or a family member. So if you're working on a nursing home issue and you don't have an advocacy organization, you could consider asking a member of the community in which the facility is located to join you. So that person could be a member of a faith community. Many congregations have individuals who can no longer attend services because they're in a nursing home, but the congregation still visits them and cares about their well-being. Or you might find someone from the community who is a member of a service club, such as the Kiwanis. So you want to really think through who brings the most helpful perspectives to your message. I want to circle back to the legislative visit and add one more point. So do whatever you can to have the consumer's voice represented. So ideally, the consumer would be at the meeting. So that's really the gold standard, having the consumer there. But we know that that can be really hard with residents of long-term care facilities. So if the resident can't be physically present, thanks to wonderful technology that we now have, you have a range of options. You could connect the resident by Skype during your meeting with your legislator. You could connect to the resident by phone. You could do a very short video or audio tape of the resident talking about how the issue has impacted him or her and the need for change, and you could show that video during your meeting. Or you could talk with the resident and write up the resident's story and recount that story during your meeting. But I really urge you to do whatever you can to get that consumer voice in the room with you, because it really makes a world of difference. So one last point about who should join you. Sometimes there really isn't anyone who can join you. Maybe it's just you have a particular time frame and nobody can make it within that time frame. So in that case, it is absolutely fine and perfect to go and attend the meeting yourself and present the message yourself. It's far better that the message be presented by one person than not presented at all. So next slide, please. You want to review your message and plan out exactly what you're going to say. It's good at this point to really think through your message. So don't expect to be given more than 30 minutes for your meeting, and that's lengthy in terms of meetings. But, and this is a really critical point, plan what you would say if you don't get 30 minutes. So this happens all the time. You think you have 30 minutes, but the decision maker is running late. So they come in, sit down, and tell you that, unfortunately, they only have 5 minutes. You need to be able to deliver your message in that time frame. Another thing that happens is that you'll be in a meeting and the decision maker you're meeting with gets a message that they're needed somewhere else immediately. So plan what you would say if that occurred. If all of a sudden the decision maker just had to stand up and walk out the door. In our trainings that we do on this topic, we do a role play when a group is meeting with a decision maker and the decision maker gets pulled away. And I have to say, the folks in those groups are really taken aback, and they're stunned. And they spend a lot of time trying to, okay, what are we going to say and who's going to say it? And meanwhile, the decision maker is walking out the door. So they have that kind of deer in the headlights look and that kind of syndrome. So what we're telling you is don't be that deer. Plan ahead. Have down who would say something and what they would say in the event that that happens, because it happens far more frequently than you might think. It's also a really good idea to think through who will say what. And in fact, it's a good idea to assign roles ahead of time and determine who's going to do what and when, so everyone's not talking all at once or there aren't long gaps of silence. It will really make your message stronger and more effective if you think through who can make which points the best. So for example, determine who's going to start off, who will open the meeting, who will share facts, who will present a personal story, who will make the ask, who will answer questions, who will take notes. So basically, you want to create an agenda for the meeting that indicates who's going to cover what on your agenda, and we really encourage you to make a real agenda for yourselves. Under who's going to cover what, include bullet points about what each person is going to say. That will help you keep on topic and move your meeting forward so that you can cover what you want to cover. So in your materials that we will be giving you the link for, you'll see that we've given you an example of what such an agenda might look like for a meeting around the 24-hour RN bill. So I hope that will be helpful to you all. Next slide. In addition, before your meeting, you should decide what information to bring with you and what information to leave with the decision maker. So we call this the Leave Behind Kit, because it's always good to leave something behind so the decision maker can reference the key points you've made after you've left. So we recommend that you have like a one-pager. It could be two-sided, but it should only be one sheet of paper. So one-page fact sheet, or it could be an issue brief that presents what you're asking for and describes the issue. So in addition to that, you might also consider maybe a relevant newspaper article from a local newspaper, or a handout that you've put together that has very specific, pertinent data that back up your request and relate back, for instance, to the legislator's state or district or to an administrator's facility. So you're trying to tie this to something that they care about. It's good to put all of this information in a folder with your organization's name on the label and your and others' business cards. That way, if the decision maker wants to get back in touch with you, he or she has that information readily available. Next slide. Okay. Well, now that the meeting's been scheduled and you've done your preparation, Mary Beth is going to walk you through what to do at the actual meeting.
Great. Thank you, Robin. Next slide, please. So in the introduction of the meeting, you're going to want to start off with each person introducing themselves. Now, if you're a constituent or if you represent a facility, say who you're representing with a 1-2 description of their program or organization. So for instance, when I go into a meeting, I would say, I'm Mary Beth Williams, Public Policy Associate with the National Consumer Voice for Quality Long-Term Care. The Consumer Voice is a national nonprofit organization that advocates for quality care for long-term care consumers receiving services at home, in assisted living facilities, and in nursing homes. So I'm giving them information about my name, my title, my organization, and that second sentence gives them more of an idea about what we advocate for as an organization. Next slide, please. You're also going to want to thank the decision maker for taking time to meet with you. Then you're going to use that opening statement that I mentioned during the Big Six that starts with something positive about the decision maker. To come up with something positive, draw on the research that you've done about the decision maker prior to you coming in. So this is kind of a pat on the back. So maybe they sponsored a elder justice bill. So you wanted to kind of open maybe with that and thank them for doing that and for their advocacy on that issue. But you should always try to find something positive if you're able to thank them in that opening statement. Again, you're going to want to indicate the issue, so what you're there to talk about. In our example, it would be 24-hour RN coverage. And lastly, you're going to make that ask. This way, if the meeting is interrupted for any reason and you run out of time, you'll at least have the opportunity to state that request up front. So always include that, always include the ask up front. It doesn't necessarily have to be a question at the beginning. Once you kind of talk about the issue, you can simply say, we're here to ask you to become a member or of a certain caucus or to become a co-sponsor of the Put a Registered Nurse in the Nursing Home Act. So you don't have to state it as a question, but let them know what that ask is and why the meeting is occurring. So here's an example of what that sort of opening statement might be like. We appreciate the work that the Congresswoman has done on important health issues. That's why we want her to ask her to co-sponsor H.R. 952, a bill that would require all Medicaid and/or Medicare certified nursing homes to have RN staffing 24 hours a day, 7 days a week. So thanking them for something positive and including that ask and also talking about that issue. Okay, next slide, please. So throughout the meeting, you're going to want to follow the plan that you prepared regarding who speaks about what and when. You're going to want to stick to your agenda in terms of covering your points, but be flexible if the conversation jumps around and you can't make them in order you've decided on. So it's very rarely the case that you can go in with the agenda of all your talking points and who's doing what and that it's going to flow perfectly. So always remember to be flexible and understand that things may get a little bit off track. So if the decision maker gets off track, or if maybe another person that actually is part of your team gets off track, either accidentally or deliberately, you're going to want to bring him or her back to the topic. So using that leave behind kit is also a great way to lead people back to the issue, maybe direct their attention to it. Once the conversation has gotten off topic, ask them to say, oh, by the way, here you can see this information about this issue that we were discussing, and veer it back to the topic for the advocacy message that you're there to deliver. Next slide, please. So if the person you're meeting with asks you a question and you don't know the answer, it's completely fine to say that you're going to look into it and follow up with them with the answer. Please don't feel pressured that you have to have the answer to any potential question that may pop up, or that you have to answer it if you're not well informed enough to give the best suitable answer. It's perfectly fine to say that you're going to follow up with that answer, and this often leads to another chance to contact that individual, opens that door for additional communication. Also, something else to keep in mind, don't argue or blow up at any point during the meeting. It's completely fair to disagree, but don't get into an argument. You can say, we certainly hear what you're saying, but our experience has been that, or something along those lines. So always keep it civil. A lot of times, some discussions can get very heated, but it's always best to keep your cool. So again, as you can see on this slide, anytime you're caught off guard, if you forgot to mention a key point during the discussion, if again that discussion maybe veers off track, you don't have the time that you like, follow up. If you run out of time, follow up. So again, take every opportunity that you may see as a disadvantage to actually be an advantage at opening that gate for communication in the follow-up. Next slide, please. Next slide as well. So again, bringing it back to the ask, you're going to make sure to make your ask again at the end of that meeting, which is what you're hoping the decision maker will do. And you want to, so at this time, at the end of the meeting, you want to wait for actual answer to your ask. So don't just state it as a statement. You're going to really want to make that ask, will you be a co-sponsor of this bill, after you've already walked through the issue, why it's important, and given all those examples that you need to make your advocacy message strong. So listen for a yes and clarify whether the decision maker where they stand on that issue. It's okay for that person to need time to formulate an opinion, but you should walk away from that meeting knowing that their position, what it is generally, or with a commitment from the decision maker to follow up with an answer to your ask. So again, anytime that you're going to make that ask, you're going to want to listen very carefully to what the decision maker says. Is it a very specific, yes, I will support this bill, or is it something vague like, I'm supportive of senior issues and I'm sympathetic to you on this? That's not an answer to your ask. So you're going to want to make sure that specifically you walk out of that meeting knowing either yes, they will co-sponsor for a bill, for example, or enact a certain change within a nursing home, for example, or they won't, or either they may say, I need some time to think about that, which is 100% reasonable, and that's going to be the answer in most cases, because either if you're meeting with a secondary decision maker, they don't have the power to make that decision, they'll have to go back to the primary decision maker, or even if you are meeting with the primary decision maker, they'll generally want to do some more research before they make a commitment. And then again, that's perfectly fine. That gives you the opportunity after the meeting to give them additional information, open up for follow-up, so you can continue to influence them after the meeting and hopefully get them to commit to your ask. Next slide, please. So it's always very important to be aware of your time during your meeting. The person you're meeting with has a very busy schedule, therefore it's good to keep respectful of the time that you're allotted for the meeting. Keep the meeting short and don't drag it out. So once it feels like the meeting is coming to a close, thank that decision maker again for taking the time to meet with you and ask the best way to follow up after the meeting. So would it be a phone call, email, another in-person meeting? What would they prefer? What's the best channel of communication for them? So once you get them to say that, they may direct you to a staff person. They may give you a specific email, a specific phone call. Maybe you could set up a additional meeting via phone call. Maybe they prefer to meet in person. So just kind of lock that down before you leave. Know how you can best conduct that follow-up and so you can continue to do your advocacy after you walk out of the door. So now we're going to do a role play exercise that shows you how to best deliver your message to a key decision maker. So I'll let Robin explain that more before we begin. Next slide.
Okay. Thank you, Mary Beth. At this point in our on-site in-person trainings, we have participants divide into groups, and they do a role play of a meeting with a legislator. But since obviously that doesn't work over the phone, as Mary Beth said, we prepared a scripted role play to present to you today. So let me set the scene. We have 3 individuals: Michelle Myers, who is a member of a state senior advocacy organization; Ron Franks, who is a local long-term care ombudsman; and Roberta Jones, who is a family member with a loved one in a nursing home. All 3 of them are meeting with a health staff person for their Congresswoman, Congresswoman Lila Smith. So just as a side note, when making a federal legislative visit, you'll find that you usually meet with their key staff person instead of the legislators themselves. So this would be a meeting with a secondary decision maker. But you know, don't be disappointed that you're not meeting with the legislator, but quote unquote only with their staff person. These staff members have a great deal of influence and actually power in terms of their work with the legislator. So in this case, the health staffer for Congresswoman Lila Smith is Jeff Jones. The 3 of them are meeting to ask the Congresswoman to co-sponsor the 24-hour RN bill that Mary Beth was talking about earlier, HR 952. So as we're doing the role play, all of you have an assignment. So here it is. We want you to identify 2 things. 1, what you think the 3 advocates did well in the meeting, and what improvements you think could be made. As we're doing the role play, when you think of something, just jot your thoughts down on a piece of paper. Just take some notes. After the role play, we will ask you to share your comments with us using the questions and chat feature that's on your screen, and we'll discuss them. So now I'd like to introduce the fine actors, I should actually say actresses, we have assembled for this performance. We have Amanda Celentano, who is our Program and Research Associate in the role of Jeff Jones, the health staffer for Congresswoman Smith. Aaliyah Murphy, Long-Term Care Ombudsman Program and Policy Associate with the National Ombudsman Resource Center as the local ombudsman Ron Franks. Tina Steyer, a consultant with the Consumer Voice as Roberta Jones, the family member, and I will be playing the role of Michelle Myers, a member of a state senior advocacy organization. The setting is a room in the office of Congresswoman Smith.
Good morning. I'm Jeff Jones, Congresswoman Smith's health staffer. I'm glad you could come by today.
Jeff, thank you for taking the time to meet with us today. I'm Michelle Myers. I'm a member of a local advocacy group, Seniors for Better Care, that advocates for quality care for nursing home residents within your district. We're here to ask Congresswoman Smith to co-sponsor HR 952, the Put a Registered Nurse in the Nursing Home Act. So this bill would require all nursing homes that receive Medicare and or Medicaid coverage to have a registered nurse, an RN, on staff 24 hours each day. But before we talk more about the bill and why it's important, I'll let the others in my group introduce themselves as well.
Hi, Jeff. My name is Roberta Jones, and I'm a family member that has a loved one living in a nursing home within your district. My mother's lived at the Sunnydale Nursing Home for over 5 years now.
And I'm Ron Franks. I'm a local long-term care ombudsman within your district. As a local long-term care ombudsman, my job is to serve as an independent advocate for residents of nursing homes and assisted living facilities. We really appreciate your meeting with us today.
Wonderful. Thanks so much for coming to talk about this issue. It's great to meet you all.
Thank you, Jeff. We thought it would be helpful if we started by explaining the need for HR 952. Right now, nursing homes are only required under federal law and regulation to have an RN 8 hours a day, 7 days a week. But RNs are really needed in nursing homes round the clock for several reasons. First, people are now entering nursing homes with acute care needs, and often very shortly after major surgery. So many have complex medical conditions that require an RN level of nursing skill to anticipate, identify, and respond to changes in condition and to ensure that appropriate rehab is going on so the person can be safely discharged home. Residents don't just need this high level of skill and knowledge 8 hours during the day. I mean, those needs don't just stop at the end of the working day. They need RN skills and knowledge 24 hours a day, 7 days a week. RN coverage for only 8 hours a day undermines effective prevention and delays intervention and really leaves residents vulnerable. A second reason that it's so important to have round-the-clock nursing RN coverage is that RNs are the only nursing personnel with the education and licensure to conduct assessments. If something happens to a resident or a resident's condition changes suddenly and unexpectedly, an RN on-site can evaluate the resident's status, figure out what's happening, and determine if the resident needs to go to the hospital to get the treatment they need or not. And this assessment can literally save their lives, but it can only be done by an RN. And the third reason why we think that round-the-clock coverage is so important is that higher levels of RN staffing result in better care outcomes in numerous areas. For example, hospitalizations, restraint use of antipsychotic medications, pressure ulcers, and urinary tract infections.
Yes, as Michelle said, RN staffing levels impact the quality of care in nursing homes. Our state does not currently require RNs around the clock, and according to the most recent data available, we have the highest rate of hospitalization in the country. We are among 6 states with the highest rate of antipsychotic use and physical restraint use, and we are significantly above the national average in terms of pressure ulcers, unintended weight loss, and urinary tract infections. This handout that is part of this packet we will leave you with shows you the statistics for our state. As an ombudsman, I am extremely concerned about the quality of care in the region of the state that I cover. I have witnessed firsthand what it's like for residents to not have round-the-clock access to RN care, particularly during evening shifts. I've heard directly from family members and residents that important resident care needs have gone unmet due to the lack of RN presence. I also know of cases where residents had to be sent to the hospital because there was no RN on site who could properly assess residents' conditions. In fact, Roberta's mother experienced just that problem.
Lack of 24 RN coverage has real and harmful consequences for our loved ones in nursing homes. My mother has suffered firsthand because there wasn't an RN present. One evening she was experiencing face and jaw pain, serious enough to cause swelling to the right side of her jaw and face. There was no registered nurse on duty, only a licensed practical nurse. After examining my mother, the LPN decided that the best treatment for my mother was simply to put her on Tylenol. Well, the next day, the pain and swelling in my mother's face and jaw became extremely severe. That morning at breakfast, she could not even eat her meal because of the pain and swelling she had, and while in bed, she nearly choked on her own saliva. At that point, she was finally sent to the hospital. My mother suffered excruciating pain and could have died from choking on her own saliva just because she was not given the proper treatment for her face and jaw pain and swelling. She then required extensive hospital treatment because she was not treated properly to begin with. My mother is lucky because she survived this ordeal, but many other residents are not as lucky. We desperately need to do something about this problem and make sure that nursing homes have at least one RN on duty around the clock.
Residents like Roberta's mother are being harmed not only in our state, but around the country. In fact, a recent report from the U.S. Department of Health and Human Services Office of Inspector General found that roughly 1/3 of Medicare beneficiaries were harmed or died from largely preventable causes when they entered a skilled nursing facility from the hospital. So not only are we concerned about the suffering of these residents, these preventable poor care outcomes cost roughly $2.8 billion in hospital treatment in 2011. So as you can see, Jeff, it's not just an issue of resident suffering, which is bad enough, but there are also significant costs to our government. 24-hour RN coverage would help reduce avoidable and costly poor care outcomes within our state's nursing homes and in homes nationwide.
Roberta, thank you so much for sharing that story with me. I'm very sorry to hear what happened to your mother, and we'll make sure the Congresswoman hears about this. I'd be interested in knowing if there's states that already require an RN on duty 24 hours a day.
In your packet, there is a handout that lists states that currently require RN coverage 24 hours a day. There are 14 states, so we know that it can be done. We want to extend the same protection to nursing home residents within our state and throughout the country by passing H.R. 952.
Certainly, the Congresswoman wants to protect nursing home residents, but she has long been concerned with putting too many government mandates on businesses in our country. She believes that government should not be in the business of telling businesses how to run their operations.
Well, we understand certainly the Congresswoman's position, Jeff, but as I'm sure you know, both state and federal governments play a really important role in regulating and paying for nursing home care. In fact, more than 75% of nursing home care is paid for with public funding through the Medicare and Medicaid programs. So nursing homes that want funding have to meet certain requirements that are designed to protect the people who receive care and live there. As the primary payer of those services, it's the government's responsibility to ensure that reimbursement for nursing home services is used to provide quality care, and that poor care outcomes due to problems like chronic understaffing or not having an RN round the clock don't cost the government more money. In fact, as I mentioned earlier, higher levels of RN staffing have been found to improve resident outcomes, and better resident outcomes decrease costs. The Congresswoman may be particularly interested in knowing that increased RN time has been found to decrease unnecessary hospitalizations of nursing home residents, and research has shown that savings in hospitalizations actually pay for that increased RN time.
Well, the Congresswoman is definitely in favor of reducing health care costs. Could you share with us the research you have that says savings and hospitalizations pay for the increased RN time? Because it certainly seems like there would be additional cost to hire more RNs to meet this 24-hour requirement. Do you know how many additional RNs would be needed? Ron, are you there?
Goodness, not sure what happened to Ron. Well, in response to your questions about additional RNs, we don't have that information about the number of additional RNs right now, but we will absolutely get that answer to you. And we can send you the research about the savings in hospital costs and how they pay for increased RN time as well.
Yeah, that would be great.
So we want to thank you again. You've been very generous, Jeff, with your time today. So thank you for meeting with us, and we really appreciate your taking the time out of a very busy schedule. Will Congresswoman Smith support 24-hour RN coverage in nursing homes by co-sponsoring H.R. 952?
I'll share the information you provided with the Congresswoman. I know she will want to receive that additional information we discussed before making any decisions.
We'll get that to you by the end of the week. What is the best way to follow up with you?
You can just send it to me, and I believe you have my email address.
So we absolutely do, and thank you. We'll be in touch and hope the Congresswoman will be able to sign on to H.R. 952. So thanks again for your time today.
Thanks.
Okay, so that is the end of the visit. And now that it's over, we would like to hear from you, just very quickly. So the first part of your assignment was to think about what the three advocates did well. So to share your thoughts, just type in the questions and chat box on the right-hand side of the screen. We'll give you just a few moments to do that. So if you have any points that you would like to share about what they did well, we'd love to hear your comments.
Okay, and Robin, let me know when I can begin to read some of these comments that are coming in.
Go right ahead.
Okay, so we have a first comment from LB Solover, I believe. They thought that the personal example was effective, as well as the validating statistics they thought were very effective. And then Susan says they were concise with the facts. Catherine stated that ask up front, so that was a very good catch. Marilyn Richardson thought it all was done very well. Kat Lyons said they took turns. There was a diverse group represented, not too many people. And Michelle Brown said that she thought that they were very concise.
I think those are all really good comments, and I think really speak to how well you all listened and obviously quickly absorbed the information that was presented before the role play, and were able to recognize it and see it, or hear it, I should say, in the role play. So I think those are really good comments. And anything else, Mary Beth, that you'd like to share?
Yeah, a few more. Again, someone said they each followed the steps correctly, that the advocates were polite, sincere, and educated regarding the legislative bill, and presented their points clearly. One comment stated, did well overall, might be improved if the ombudsman could end with frequency of dire consequences, some statistics on deaths. Then the family member would give the example. So a little bit of a suggestion on something that could have been added to the ombudsman part. And lastly, our last comment stated that they did well in providing those introductions and identified the ask early on. When they didn't know that answer to the question, they stated they would follow up and give back to the person who was the key decision maker. So that was very positive, and the evidence that they gave was compelling.
Fantastic. I think those are very perceptive comments, and we really thank you for that. One thing I wanted to point out was when Jeff, the staffer, was talking about how the Congresswoman basically does not believe in government mandates on businesses. That was a bit of a sticky wicket. So what I can speak for Michelle, since I was Michelle, what she was trying to do is sort of talk about how government actually has responsibility for protecting residents because it is the payer source. And then what she tried to do was sort of deflect slightly and take things in a different direction, and went into talking about the cost, because then you had some solid points she had some solid points to make about cost savings. So that's something just to keep in mind, because you will definitely encounter those folks that are not supportive of the position. Those are excellent comments and feedback. Somebody already gave us one suggestion, which was excellent, but let's give the others of you just an opportunity. What improvements could be made? So if you'd like to enter into the question chat box your thoughts about what improvements would make this better, we'd love to hear them. And Mary Beth, just feel free as they come in to read them.
Okay, so we haven't had any come in quite yet, so just waiting.
Okay. And I just want to mention while we're waiting that we did experience a few little technical difficulties during the role play. So I would note that that's an improvement that we need to make from our end.
Okay, so we've had a few come in, and this is a really good point from Susan again, who states maybe reconfirm the email address of the staffer. So the staffer said, you have my email, maybe reconfirm that to make sure that it's the correct one.
Definitely. Yeah, you don't want to make assumptions.
And Catherine says that she would include cost information in the data right up front. Legislators respond to the issue of increased costs very well. Someone else, Carolyn, says go in with more cost information, so again, the cost information, and less emotion, perhaps. And someone said that they didn't hear the positive comment about the key decision maker in that introduction, so when they gave the introduction at the beginning of the meeting.
You all are very on top of this. I'm impressed. I noted that as well after the fact. Yes, there was not a positive opening in there, and there really should have been. So excellent point. And I think these other points are about costs are very well taken. And we know that cost is critically important. You don't, as we said earlier, want to only do cost. You do need to put the human face on that. But I think the point about putting cost first really could make it stronger. So thank you all so much. I think those are really good suggestions. So right now I think we want to move on and just sort of wrap up the third part of the meeting. Next slide, please. Okay. So once the meeting is over, you want to make sure to follow up. So next slide. So the first thing to do is to thank the decision maker, and you can do that in a number of ways. You can handwrite a thank you note where you repeat your key points and any commitments that the decision maker said they'd make. Or you can send an email, and in this day and age, an email thank you is perfectly acceptable and frankly would get there a lot faster. One important point, you want to make sure to use this thank you not only to thank the decision maker, but also to get back to the decision maker with any follow-up you promised to do. So for instance, in the role play that we just did, the group would want to get the answer to the question Jeff asked about additional RNs and provide the research about hospitalization and RN time with that thank you. So you want to get it to them as quickly as you can. That does depend on how quickly you can get the answers. It would be all right if you thanked him for the visit and said that you are researching the information and will respond shortly. Then you can get back to him another time and use that as yet another opportunity to get in front of his eyes. So once you've sent the thank you, you should wait a few weeks, but then check back if you haven't received a response. You can do this with a phone call or email, but I haven't heard from you, and I was wondering if you'd had a chance to talk with the Congresswoman and whether she has decided if she will support H.R. 952. Next slide. And it's also a good idea to follow up periodically. You can do that in a number of different ways, too. You can send emails with some updates. You can invite the decision maker to your group's events. One way that I think is particularly effective is to send interesting articles or reports periodically that relate to your issue and that support your position. So all of these things keeps you and your issue fresh in the minds of the decision makers, and frankly, it shows them that you're not going away. So we've covered the 3 parts of conducting a meeting at this point, and now we want to give you a chance to ask some questions. So next slide. And I think Mary Beth is going to lead us through this part.
Yes, thank you, Robin. So many of you have already asked questions, which is great, but if anyone else has any questions they'd like to ask, again, you're going to want to enter that in the questions/chat feature in the right-hand side of your screen, and they'll pop up for us, and we can work through them. Now, we have a few questions, so I don't know if we'll be able to cover them all in the time that we have left, but feel free to follow up with us. We have our contact information at the end of the presentation, and we're more than happy to give you those answers. So the first question comes from Brenda Alvarado, who asks, will this mean that most nursing homes would be able to take a higher level of care resident, i.e. a resident returning from the hospital with a PICC line, for example?
So obviously that will depend on the overall capacity within the nursing home, but having an additional RN would certainly make it more possible and more likely that they could take individuals directly from the hospital with that kind of need. Mary Beth, is there anything you'd like to add?
No, I think that's a good answer. Another question about the bill, which is actually makes a very good point because this is our fallback option. Chris from Idaho says Idaho is a rural area and having a nurse 24 hours may be difficult to find. Then what happens?
So that is an excellent question, as you pointed out. Our thoughts, and these are our thoughts at Consumer Voice, and that we've been thinking about is that there may perhaps be the option of offering a waiver or an exemption under certain circumstances. So if the facility, I'm making this up off the top of my head right now, but if the facility could could demonstrate that it's made a good faith effort, to find an RN for those additional shifts, and perhaps met other circumstances, they could perhaps be granted a waiver for a certain period of time to allow for some of those areas that are rural where it might be hard to find RNs. This was done when the Nursing Home Reform Act first went into effect, and the Director of Nursing was required to be an RN. There were lots of problems at the beginning with making that shift, and a waiver was allowed. Now, today, basically, there are almost no nursing homes that don't have a Director of Nursing as an RN. So, excellent question, and we are thinking about that perhaps as a fallback.
Great, and I just add, this is a point we often make too, is that regardless of whether it's a rural area or an urban area, residents in these facilities deserve the same level of care, and they deserve 24-hour RN access. And states have been able to make that work in several cases. So I would just add that point to your question and answer as well. The next question.
Really glad you added.
Oh yeah. Of course. The next question is more about the advocacy. So what if my legislator is not pursuing re-election, Nancy asked. Does identifying myself as a constituent still carry weight? And I would say yes, Nancy, because even if he or she is not pursuing re-election, it's still his job as a legislator to represent the interests of his constituents. And a lot of times people come into meetings that aren't constituents, and they're not as likely to pay more attention, to pay the most attention to those individuals as opposed to constituents, because they feel they're in office to serve the individuals that they're elected by and that are their direct constituents. So I would say it would still absolutely carry weight, and depending on the legislator. Okay, so moving on to the next question from Joanne about the RN bill specifically, asked, would it imply that a private nursing home, one who only takes private pay residents, would not have to comply with this bill?
Well, if it's a private nursing home and it gets absolutely no money from Medicaid and no money from Medicare, it would not have to comply with this law. It would have to, the facility would certainly have to follow state regulations, and their state regulations may call for 24-hour RN, but if there are no government funds going in, they don't have to follow government regulations. There are not too many of those facilities out there, but there are some.
Okay, and do we have time for one more question, Robin, or should we move on?
We do.
Okay.
We do.
So the last question from Chris, and again, if you have a question that wasn't answered, please follow up with us. But the last question is specifically, who will pay for the extra cost of RN for 24 hours? Will that cost be added to the resident's cost of living in a facility? So again, that cost issue, how are we going to pay for those extra RNs?
We are in the process of doing some cost analysis. Our initial data shows that it looks like it did not cost very much money for a facility to bring, add additional RNs. At this point in time, it's not anticipated that there would be extra or more government funding. So again, at this time, it would be the facility's responsibility, but I do think we need to go back and look at that research that showed that higher levels of RNs improve costs and bring down unnecessary hospitalizations. And nursing homes are going to be looking at penalties if residents are sent unnecessarily to the hospital. So it's the RN who's going to be able to conduct that assessment in the facility. So in many ways, it's going to be economically effective for a facility to make sure it has a 24-hour RN in order to avoid penalties from hospital readmission. So I think with that, we'll just close. I want to thank all of you for taking time out of what we know are very busy lives to participate today. We hope that you'll start applying what you've learned in your own work and to our campaign to pass the Put a Registered Nurse in the Nursing Home Act. All of you are our constituents and allies, and we need your advocacy efforts if we are to be successful. So look for action alerts from us, and if you're not part of our action network, we urge you to join. Next slide. Okay, this gives you our website. So if you go to our website and go to the right side and scroll down, you will find a box that talks about Join the Action Network. And just click on that, and it will guide you through the process. We also want to encourage you to join us for a number of activities next month. Next slide. The month of May is really going to be a big month for our 24-hour RN campaign. As you can see, on May 12th, we're holding a webinar on the issue, the bill, and advocacy opportunities. This just happens to be Florence Nightingale's birthday, so we thought it was a good day to have a webinar on RN coverage. After the webinar, we're having a National RN Action Day on May 20th. And on that day, we hope to mobilize people from all across the country in our network, and we hope outside of our network, to contact their member of Congress in some way, shape, or form, by email or by phone, to call or email and ask their legislator to come onto the bill as a co-sponsor. Our hope is that we can really bring attention to this issue by focusing this effort in one day. So we hope that you'll join us for both these events, but we have other webinars coming up as well. Next slide, please. Now that you've learned how to deliver your message in person, we'd like to invite you to participate in our upcoming national webinars. The next one, our third one, is on June 30th, and it's on delivering your message utilizing both traditional approaches and social media. And then our fourth webinar and last one will be on August 27th. Next slide. We want you to know that we are always available to answer your questions, questions that you might have related to advocacy efforts or about the issues. Please contact us if you need help or more information. On the slide, we've listed your go-to people and how you can contact us. So please don't hesitate. We really want to be as helpful as possible. And finally, last slide. I want to close the way I closed in our first webinar, which is by just taking a moment to thank all of you for the work that you do day in and day out to help long-term care consumers or others on whose behalf you may work. We know that that work can be very difficult, and we don't think that you all get thanked nearly enough. So on behalf of those of us at Consumer Voice, and on behalf of those that you serve who can't thank you, we want you to know that what you do is greatly appreciated and that it really does make a difference. So thank you, thank you, thank you. And with that, we'll end today's webinar and look forward to having you join us on our webinar in June. Thank you again.